If you've noticed a bubble or lump under your skin after injecting Mounjaro, you're not alone, and in most cases, there's nothing to worry about. Let's talk about why this happens and what you can do about it. Before we dive in, a quick note. This video is for general information only and isn't a substitute for medical advice. Always follow your clinician's guidance, the patient information leaflet that comes with your medication, and the instructions for use that come with your pen. If you have any concerns about your treatment, speak with your GP, diabetes team, or pharmacist. So, what is Mounjaro? It's a once-weekly injection prescribed for managing type 2 diabetes in the UK. The medication, which contains tirzepatide, is given as a subcutaneous injection, meaning it goes into the fatty tissue just beneath your skin. When you inject, that medication needs to sit in the tissue for a bit before your body absorbs it into the bloodstream. Sometimes this creates a visible bubble or lump, and whilst it can be concerning to see, it's usually completely harmless. What's actually happening under your skin? There are a few common reasons you might notice a lump. First, it could simply be what's called subcutaneous depot formation. That's just a medical way of saying the liquid medication is pooling temporarily in a small pocket of fatty tissue. Think of it like a tiny reservoir that your body gradually absorbs over the next few hours or days. This is a normal part of how the injection works. The way you inject can also play a role. If the pen isn't positioned correctly, or if it's moved too quickly during or after injection, the medication might not deposit as evenly in the tissue. And finally, anytime you pierce the skin, there's a bit of minor trauma to the tissue. Your body responds with a small inflammatory reaction, which can cause temporary swelling, redness, or tenderness right at that spot. The good news is that most of these injection site reactions are mild and resolve on their own. According to the product information, they typically clear up within 24 to 72 hours, and they don't usually affect how well the medication works. Now, proper injection technique is really important for minimizing those lumps and bubbles. The key is to follow the manufacturer's instructions for use that come with your specific pen. These instructions will guide you through the correct positioning, how to confirm the dose has been delivered, and the proper hold time after injection. Getting these details right can make a real difference in preventing visible lumps. One of the most important things you can do is rotate your injection sites. Mounjaro can be injected into your abdomen, your thigh, or the back of your upper arm. Just a note about the upper arm. Injections into this area are typically given by a caregiver rather than self-administered, as it can be difficult to reach properly on your own. If you keep injecting in the same spot over and over, you can develop something called lipohypertrophy. That's when the fatty tissue becomes lumpy or thickened, which can make future injections less comfortable and potentially affect how the medication is absorbed. A good system is to keep track of where you last injected and move to a different area each week. You might even want to keep a simple log or use a rotation pattern that works for you. If you do notice a lump after injecting, there are a few things you can discuss with your healthcare professional. They might suggest applying a cool compress to the area if there's swelling, though avoid putting ice directly on your skin. Generally, it's best to just leave the area alone and let your body do its work. The lump should gradually reduce and disappear as the medication is absorbed. However, there are times when you should reach out to your doctor or diabetes specialist nurse. If a lump persists beyond 72 hours, that's worth checking out. You should also seek medical advice if the area becomes increasingly painful or if you notice signs that might suggest infection. These include warmth at the site, redness that's spreading outward, or any discharge. If you develop a fever or feel generally unwell, contact your GP, NHS 111, or emergency services as appropriate. These situations are uncommon, but they do warrant professional assessment. It's important to remember that everyone's experience with injectable medications can be slightly different. What you're seeing and feeling might not be exactly the same as someone else. That's why it's always best to discuss any concerns with your healthcare professional. They know your medical history and can give you personalized advice about your treatment. To recap, Bubbles or lumps after Mounjaro injections are usually harmless and happen when the medication temporarily pools under your skin before being absorbed. Following the manufacturer's instructions for use carefully can help prevent them, and rotating your injection sites each week reduces the risk of persistent lumps and skin reactions. If a lump lasts more than 72 hours or shows signs of infection, speak with your healthcare team. If you've had experience with Mounjaro injections, feel free to share your tips in the comments below. And if you found this helpful, please give it a like and subscribe to Bolt Pharmacy for more trusted health information.